Namaskar, welcome to This Week with Padma Shri Dr. Sudhir Parikh, and everyone, not just in India but across the globe, is focusing on something which has emerged as a potential threat for whole humanity. We'll be talking about that. Welcome, Dr. Namaste.
Welcome.
So you guessed it, the reference is coronavirus, and there are already potentially confirmed 3,000 deaths, and they say that those who were confirmed, almost 3.43% have died. So how serious do you think it is?
It is very serious because usually in any other influenza viruses in the past, the death rate is only 0.02%. And this is already 3 to 4%, and we don't know real numbers that whether 3,000 died or 5,000 died, right? Still, it's evolving story. So I think this is much serious, and it is serious because there is no vaccine available to prevent this thing, as compared to a flu virus where we get every winter. H1N1 viruses, we have vaccine. So by giving, and that vaccine is usually 50 to 60% effective. So those who takes the vaccine, usually they are protected at least for 60% of the people time. So I think, and this virus has no vaccine, no treatment, and still we have no handle how it spreads. Before we thought that if you quarantine person, then you are preventing the spread, but it's not so. Because now we found out that in USA there are 6 deaths happen in West Coast, and all 6 deaths is because of they never travel anywhere, they didn't go anywhere, and still they had a coronavirus and they died because it's a it's a community based or community acquired infection. It means somebody must be carrying their infection who has no symptoms, come in contact with this person who got the symptoms, and he being elderly or young or whatever, or compromised health person, he died.
Yeah, so let's hear from you. When you say come in contact, is this disease traveling from one to another through touch or what?
Yes, both touch and the respiratory. But see, I mean, the mystery part of the whole thing is that there are still people around us might be carrying coronavirus and we don't know. So that's what happened today in Westchester. One death happened, and there also it was community acquired infection. So that's why it's very, very difficult to put the hands on this problem. And vaccine is almost 6, 7, 8 months away. I mean, they are trying very vigorously to develop that vaccine, but still it takes that much time to develop. The treatment, there are a couple of companies who has some medication, but they have to go through certain phase 1, phase 2, phase 3 study before they put in the market, because they want to make sure that it is not only effective against coronavirus, but there is no other side effect.
Yeah. So another preventive method which we have heard quite often is wearing mask, and recently
even wearing mask is not very preventive, because mask it's because the coronavirus stays alive on the surfaces very long time. So the most important thing is washing the hands, not shaking the hands with the people. I mean, though it sounds very unsocial thing to do that, but it is now. We came to that point that because everything is so unknown, so you are better off not. Don't expect anybody to shake your hand, or you should not, or you should discourage people to shake hands.
So maybe follow the Indian style of namaskar.
Right, namaskar is the best way to do, and keep washing your hand. And keep wash and put wear the mask. At least you don't. If you have coronavirus, you don't give it to somebody else, or somebody doesn't give it to you. Whatever protection happens, and of course avoid crowded place, avoid restaurants, avoid. I mean, it's very bad thing to say, but avoid, don't travel as much. I mean, travel only necessary thing, and don't go to places where like sports, games, stadium. Those are the places you can chances of getting coronavirus is very high.
So in this context, I am reminded that there was a huge event with Shri Ravi Shankarji planned in New York, and now it is postponed.
Been postponed, yeah.
Right. That again, as you said, don't go a lot of people together. But I want to take you to India with this threat. There is one Italian tourist reported in Jaipur confirmed coronavirus, and in Delhi, one hotel, they have quarantined 25 tourists. So how they figured it out? And then allow me to add that Prime Minister Narendra Modi tweeted or asked people, do not panic. But will it serve people not to panic?
No, I mean, it's a human nature. People are going to panic because the fatality is very high. 4% is very high. 3% is very high. And quarantine doesn't work because how many people you quarantine? And in USA, you know that quarantine is unconstitutional even. You cannot quarantine people here in our country.
But in some circumstances like this, probably there.
No, you cannot control. You cannot quarantine. Only thing you can say that you cannot have big function. You cannot have crowd. You cannot have big meetings. You cannot. You can do those things, but you cannot keep the people locked up in one area, just like what China did. And we don't know whether how much it was successful. Because unfortunately China is very opaque, is not transparent. So numbers and things which we get, news is not very 100% reliable, right? And in India, I'm afraid that India is the worst place to have coronavirus if at all it will happen, because half of the population lives in kind of very undesirable condition. They live in Jhupparpatti, close to each other. In even lower middle class, those who lives in apartment or home, they have 500 square feet apartment with 8 people are living there. So it's very disastrous situation there in India. Actually, Indian government should, I'm sure they will be more proactive than reactive, because in India, if right now, so far India is lucky, there is not many cases, but if once it starts, then it's very difficult to control because of our sheer population, sheer poor sanitation and poor condition of the living for the majority of the people. I'm not talking about 20% of the well-to-do people, I'm talking about 80% of the not well-to-do people.
Correct.
And so in India, I think the challenge is much more than USA. And USA is more equipped, we are here more equipped with the treatment, because their complication is a fibrosis of the lung and collapse of the lungs and those things, and that's why people die. And the healthcare facility is much more equipped here, and much more healthcare availability is here than back home.
So, continuing with what concern you have also highlighted, Prime Minister Narendra Modi also tweeted with certain steps as preventive measures that included sanitizers and a couple of steps. So, what would you advise Government of India at this point, if there is anything else that they are not doing which they should be doing in order to prevent the spread of this?
No, but I mean, they must proactively educate all the healthcare professionals. They should not take it granted, because we have tendency, because I'm graduate of the India, and at least when we were there, or people takes things too much granted, and that they should not. And that's and hospitals should have plenty of masks. They should have plenty of anti-infective thing which all the doctors and nurses can wash every time they handle a patient. There should be good ventilation in the and control, climate control in the hospitals. And I mean, if you go to India's our government hospital, half of the patients are sleeping on the floor because so crowded, right? I mean, that's not their fault either.
Correct.
And this kind of infection, it's disaster. And plus, we have a tendency that with one patient, there are 3 relatives comes there and sleep there. So they are also more. It complicates more.
Mm-hmm. So just let's touch quickly the other side. Is it somewhere related to food habits also, like because it seems to have originated from some animals?
Well, that says that it is originated from some dead animals in some laboratory in China. I'm not sure. I don't know exact truth story, but it's possible that this virus probably transmitted through some animal, dead animal or live animal, or somebody is consuming that animal meat or something.
Mm-hmm. So as we move towards the concluding part of this special conversation about coronavirus, about the preventive measures that one can take, but based on what I hear, there is still concern. There is no 100% foolproof way to prevent it from spreading.
Yes, there is no 100% foolproof way to prevent. Only thing we can do is to wash our hand, protect our cough, and don't touch our face too much. Don't go to crowded place. Don't go to any place where there is too many people, and don't travel unless it's absolutely necessary. And of course, overall be healthy. And as soon as you get some kind of cold-like symptoms and you don't get better in 2-3 days, go and see your doctor. That's the best advice I can give at the moment.
Mm-hmm. So I appreciate all that you have shared, and I'm sure it's going to help some of you out there. As we move towards the concluding part, anything that you would like to say, looking at the present day world where we need a lot of peace, harmony, and sense of unification?
Well, I think I hope that world remains best place to live with the peaceful. Everybody should live peaceful, respect each other culture, religion, and try to be more helpful to each other rather than compete with each other. So that is my message, and I'm sure we should live as a world. I mean, Vishwa is one.
Vasudhaiva Kutumbakam.
Vasudhaiva Kutumbakam. Whole world is a one family, and we should live as a family.